Hi, I'm Brenna Wright. For our presentation topic, Lily, Jozlyn, and I chose to talk about how to measure health or health status. A little bit about this lesson. Our lesson objective is to help people learn how health is measured and what health should or should not look like. Most measures of health are usually expressed using health statistics that are based on the traditional medical model of describing ill health instead of well health. So this means that basically the lower the presence of injury, disease, or death indicators, the higher your level of health is. And then a few ways to measure health are through rates, life expectancy, years of potential life lost, disability adjusted life years, health-related quality of life, and health surveys. First up, we're going to talk about rates. So a rate is a measure of some event, disease, or condition in relation to a unit of population along with some specification of time. They provide an opportunity for comparison of events, diseases, or conditions that occur at different times or places. And some examples of commonly used rates with measuring health status are death rates, birth rates, and morbidity rates. Next up, we're going to talk about life expectancy. So life expectancy is based on mortality, and it takes into account the average number of years of life remaining to a person at a particular age, and it's based on a given set of age-specific death rates. Life expectancy is considered the most comprehensive indicator of patterns of health and disease, as well as living standards and social development. And life expectancy can be determined by sex, race, Hispanic origin, or other characteristics based on age-specific death rates for a population that has similar characteristics.
All right. Hi, everybody. My name is Lily Hoffman, and I am going to be discussing another health measurement that is known as years of potential life lost. In order to calculate YPLL, you have to subtract a person's age at death from 75. So, for example, if somebody died when they were 20 years old, you would take 75 and subtract that from 20, which would give you a YPLL of 55. Now, the reason that we're continuing to use this a little bit more is that the life expectancy has been increasing. People are living a lot longer, so it gives us a little bit more of an accurate description of somebody's health. All right, so another health measurement that we chose to discuss was disability adjusted life years. This is also known as daily. Now, this measurement is super easy to understand. It is calculated by adding together YLD, which is years lived with disability, and YLL, which is years of life lost. And once you add those together and get the sum, that gives you disability adjusted life years. So we use this because mortality does not take into consideration the burden of living with a disability. So we wanted something that was going to include that burden, and daily gives us that.
Hi, I'm Jozlyn, and I will be talking about health-related quality of life, which is a multidimensional way to measure all aspects of health, including but not limited to physical, emotional, and social. Health-related quality of life measures the effects of a healthy life on your quality of life, as well as the effects of an unhealthy life on your quality of life. A healthy life could include things such as frequent exercise and/or preventative measures like vaccines, and an unhealthy life could include things like chronic illnesses and/or disabilities. Health-related quality of life also takes into consideration gender, employment status, income, race, education, and more. As you can see in the chart to my right, it shows that a lot of different things go into the overall quality of life. Quality of life is important to promote a long and healthy life. Health surveys are another good way to measure health because you obtain direct data which is found in the form of a questionnaire given to people. There are several different types, and some of the most commonly used and known include National Health Interview Survey and NHANES by National Center for Health Statistics. Health surveys make it easier to categorize results based on race, gender, age, etc. Health surveys can be used to collect data which help with other measurements of health.
So now that we are done going over our PowerPoint, we wanted to do a quick little quiz to see if anybody was paying attention. So the first question that we chose to ask is, which of the following is not a measure of health that we discussed? A, blood pressure. B, years of potential life lost. C, disability adjusted life years. Or D, health-related quality of life. And as you can see on this slideshow, that the correct answer is A, blood pressure. We did not go over that in this PowerPoint. Our next question is, which measure of health is calculated by adding the YLD and YLL together? A, years of potential life lost. B, health-related quality of life. C, disability adjusted life years. Or D, health surveys. And as you can also see on the slide, that the correct answer is C, disability adjusted life years.